Hello, I'm Dr. Acerno, and I'm one of the pediatric surgeons at the Marybridge Children's Hospital. Welcome to our gastrostomy tube educational video, brought to you by the Marybridge Pediatric Gastroenterology and Surgery Clinics. There are many medical conditions that make it difficult or impossible for a child to eat by mouth. A gastrostomy tube is a convenient, comfortable, and effective way to provide direct access to the stomach for feeding. In this video, you will learn how a button gastrostomy tube works, basic skills to keep the tube and site clean, how to address common problems, and who to contact when you have questions or concerns.
A gastrostomy tube, or G-tube, delivers nutrition, liquid, and medication directly to the stomach, bypassing the mouth and throat. It's one of the ways doctors can make sure kids with trouble eating get the fluid and calories they need to grow. The surgeon will attach the stomach to the abdominal wall and then connect the G-tube directly to the stomach. A small balloon inside keeps the G-tube in place so it does not fall out. You will now be able to insert liquid nutrition or medication directly into the stomach through a port. There are different brands of button G-tubes, and your doctor will choose the one that fits your child's needs best. There is an inflatable balloon at one end of the G-tube and an external base at the other end. After insertion, the surgeon will fill the balloon with water, and the external base will sit just outside the body with about a dime's thickness of space underneath for air to reach the skin. The button has two ports, each with a one-way valve, a feeding and medication port, and a balloon port which says BAL on the side. The feeding port has a cap. Make sure it's in place whenever you're not using that port. Your G-tube will come with a kit of extension tubes and syringes. The shorter, thicker tube is called bolus extension tubing and is used for intermittent feeds or gravity feeds. The longer, thinner tube is called continuous extension tubing. This is designed for continuous feed by pump, but can also be used for intermittent feedings. It has a separate port for administering medication. The smaller syringe is typically used to deliver medication, to fill the balloon, or to flush the extension tube. The larger syringe is used for feeding and venting.
Hospital staff will teach you how to deliver formula medication through the G-tube. Be sure to get plenty of practice to be comfortable before your child is discharged.
There are two ways to feed: continuous feeding, which is over several hours or all the time, or bolus feeding, which usually lasts 20 to 40 minutes. Your care team will determine the right feeding schedule for your child, what to feed them, and how much to provide. After you wash your hands, prime the extension tube by filling it with water so less air will go into the stomach with the feed. Use the clamp to keep the water from running out. To attach the extension tube to the feeding port, line up the two black lines and then rotate clockwise until you feel resistance and it has locked in place. Once it is attached and you are ready to feed, unclamp the tube and commence with feeding as directed. Be sure to hold and nurture babies during feedings the same way you would if you were nursing or bottle feeding. After the feeding, disconnect the extension tubing by turning the attachment counterclockwise until the black lines line up again, and remove the extension tube. Do not forget to close the cap. If you need to administer continuous feeds by pump, you will receive the pump from Home Health and they will teach you how to use it. Liquid medication can be given through the same port as the feeding. Start by loading the small syringe with the medication and set aside. Then prime the extension tube with water, using the clamp to keep the water from running out. Attach the extension tube to the button the same way we did for the feed. Unclamp the tube, and then gently push the medication through the tube with the syringe. Afterwards, flush the tube with 5 milliliters of water to make sure all of the medication gets through.